Basic clinical, financial, and administrative reporting, all the data that you collect in an electronic health record, in order for it to be a true continuity of care record, you should be able to do clinical, financial, and administrative reporting on it. Whether they are predefined reports based on certain templates, or they are ad hoc reports for any kind of decision making. For example, if you wanted to see a particular age group whom you have prescribed a particular medication for acute ear infection, you should be able to do that kind of statistical and epidemiological analysis, whether it's based on certain age group, gender, or any type of population. All of that basic comparative analysis, an example that you see on the slide is number of patients with hypertension and diabetes versus number of patients with diabetes only or hypertension only. So this kind of effective cross-reference data and cross-analysis is very useful for to guide users as well as clinicians in their practice, whether it's clinical or financial. Which leads to outcome status and quality measures reporting, measurement, monitoring, and analysis, any aspects of care indicators, and all this kind of resource allocation and real-time surveillance will lead to increased regulatory standards, whether they are prescribed by a regulatory board or if they are something that you have decided globally within your practice, that these are the rules that need to be enforced for quality patient care. Health maintenance and disease management protocols is another benefit of electronic health record, whether it is termed of preventive care and wellness or preventive notifications and responses, which is very helpful during the time of point of care, because a lot of times a particular diagnosis may be further explored or may be missed. As a result of disease management protocols, these things are identified based on known disease patterns or based on prediction of health risks at the time of point of care. So any deviation from standard protocols or better surveillance of predictable disease patterns can be easily identified in an electronic health record. Finally, health education and health directives are issued within an electronic health record. SequelMed EHR has these embedded, and it provides different identifications based on whether it's specific populations or whether it's based on specific specialties. You can benefit from these health management initiatives whether you are a physician or any other clinical field, because SequelMed EHR would provide integrated disease management support for the education, outreach, and care to patients, which will eventually lead to informed therapy, as well as effective analytical management of all the health-related concerns, leading to ultimately what the goal, as I defined in the beginning of the presentation, was improved quality care. A lot of times improved quality care is compromised when an EHR is thought of because now you're doing something on a computer as opposed to doing something manually. And many of these issues can be overcome once the willingness to adapt EHR is accepted both psychologically and physically. And these returns of investment, like I said in the beginning, are a very important aspect of EHR, but they require a learning curve, because of which we have a very practical approach to implementation. Instead of SequelMed EHR sort of being dumped on the client and implemented and having you go through a requisite 3 to 5 day training, we realize at Sequel that it takes a little bit more time in order to implement the CMR, because there is a whole paradigm shift. And this is a word that I use quite often in terms of adaptation to EHR, that it is literally a paradigm shift when it comes to moving from a manual record to an electronic health record. So what we have done at Sequel, and the way we implement SequelMed EHR for our clients, is adapt a progressive approach to implementation. which is what what we call a practical approach to implementation. And the way it normally works is that we work with the client on their clinical flow, do a complete workflow analysis, and come up with their templates in order to understand how they use their clinical examination throughout the practice. This does not mean that we do not have predefined templates like a lot of companies do. We do. And we offer you all those predefined templates, but the customizability and flexibility of that template building is what is the main point in our EMR, in our EHR, because it facilitates the adaptation of workflow to the exact way, or close to the exact way, a physician does in their office. So that flexibility and customizability is lent throughout our EMR. Also, our goal usually is that we should not be able, that a physician or any user of the EMR should not be